And kind of switching back to women's health, it is essential to be proactive when it comes to the risks associated with certain types of cancer.
Alex had the opportunity to chat with a doctor about the importance of getting tested.
Well, I've heard that putting the paper gown on at a gynecologist appointment can be pretty uncomfortable, but these annual visits are key to women's health, including identifying gynecologic cancers such as cervical and ovarian cancers. Well, joining me now to discuss the importance is Dr. Sharon Lewin, Medical Director of Holy Name Medical Center. Good morning, Doctor.
Hi, good morning.
It's really nice to have you on. Now, there was a survey conducted recently. Can you tell us about it and what you found?
Absolutely. There was a survey conducted by Genentech and the Foundation for Women's Cancer. Over 1,000 women across the United States were surveyed, and we found that women were more likely to see their dentist, eye doctor, even their hairstylist on a yearly basis than seeing their OBGYN. Furthermore, we found that while over 80% of women were quite concerned about cancers, less than 10% of them actually spoke to their OBGYN about ovarian and cervical cancer.
So it seems like a lot of them are disregarding it as something that they have to check, and really they should be watching out for the health. Now, what is so important about visiting an OBGYN anyway?
Well, the survey results really mirror what we see in practice. Women definitely need to see their OBGYN on a yearly basis, regardless of their age. It's such an important time to be screened for cervical cancer, which can actually be prevented in the United States if women actually had their pap smears. It's an important time to talk about their risk for uterine and ovarian cancer, as well as other cancers such as colon cancer, breast cancer, and other important health issues like heart disease and osteoporosis. So I can't stress enough the importance of the annual visit to the OBGYN.
I think part of the problem is maybe a lot of women think, oh, it can never affect me, but really, doctor, how prevalent is it in women?
It is very prevalent. I mean, every 9 minutes in the United States, a woman is diagnosed with gynecologic cancer. Cancers will affect 1 in 2 or 1 in 3 women in their lifetime. So it's very important to have these conversations with your doctors. I really empower women to ask, am I at risk for cancer? What type of cancers? And what can I do to change my risk factors? It's so important.
It is. Now, is there a certain age range, or who's actually most affected by something like this?
In general, cervical cancer usually affects young women. The unfortunate thing is that cervical cancer really could be eradicated if women actually had their pap smears, because any precancerous cells could actually be treated before they turn into a cancer. The HPV vaccine, or human papillomavirus vaccine, is so important to help prevent cervical cancer as well as precancers. Usually women who have ovarian cancer are older, in their 50s and 60s, even older than that, postmenopausal. It's so important for women to find out about their family history, if anyone has had cancer and at what ages, and really speak to their doctors about it, because it may, herald a genetic link or something that can be prevented to help prevent these cancers in the first place.
Right. And say somebody's watching this now and the light finally goes on. How do they even start that conversation with their doctor?
The first step is to really make an appointment. Definitely see their OBGYN. I empower you to talk to your doctor about cancer. Don't be afraid. Ask if you have any risk factors for cancer and what you can do to change those risk factors. It's just so important to go and actually initiate these conversations.
Okay, and so we've diagnosed the problem. Now there has to be a solution. How is, these types of cancers, how are they treated?
There are very effective treatments. It's very important that women actually see a gynecologic oncologist when they're diagnosed. Cervical cancer can be even treated and prevented before it becomes a cancer. There are a lot of fertility-sparing options available for women who want to preserve their fertility and have children if these things are detected early. It's important with ovarian cancer that women have a very thorough surgery initially to remove all visible areas of cancer, followed by what's called intraperitoneal chemotherapy, or chemotherapy in the belly. There are drugs like Avastin, which is FDA approved for women with recurrent or advanced cervical cancer or certain types of ovarian cancer. So there are treatment options available for women. There may be some side effects, particularly with Avastin, looking at bleeding or different issues with tissue or wound healing. So it's just very important to have detailed conversations with your physicians about these cancers if they develop, and the best ways to treat them.
Yes, and really quick, where can people go and get more information about this very important topic?
The Foundation for Women's Cancer.org is a wonderful website to talk about signs and symptoms, prevention and treatment. excellent resource for patients.
All right, Dr. Lewin, thank you so much for coming on and sharing this important message with us.
Thank you for your time, Alex.
All right, and stay where you are. The Morning Blend will be right back.